attendees currently in the room, so they're probably eagerly awaiting our presentation.
Okay. All right. Good afternoon, everyone, and welcome to our webinar on the reopening for hair salons and barbershops.
On that side too? No.
I'd like I'd like for you to know that I'm joined by my colleagues today, Jerry Garcia and Anna Nevis Wynn, and we have the Health Director of the City of New Haven, Maritza Bond, and we will have Doctors Carrie Redlick and Dr. Queenie Abad from Yale Occupational Environmental Medicine join us as well. We're here to discuss the rules today and how it relates to the reopening of hair salons and barbershops on June 1st. And the doctors are going to discuss the basics of COVID. They're going to talk about how it's transmitted, the best way to protect yourself, the pros and cons of the different types of masks. So we will have Q&A. Q&A follow both presentations. Make sure you post all your questions in chat. And we're going to start off with the City of New Haven Health Director, Maritza Bond. Thank you for joining us today, Maritza.
Thank you. Thank you, Kathy, for the invitation to provide an overview of what to expect for this new reopening process in regards to reinspection. And so, as you know, we had a delay in the reopening for hair salons and barbershops. And so it is my hope today to just reiterate the reopening guidance that we set forth for the anticipation to open for June 1st. And so I will walk through these slides again, and then we will provide an opportunity for Q&A after the presentation so that I can be able to assist in any way that I can. So it is my goal to really talk about and illustrate the hair and salon barbershop inspection form and talk a little bit about that process, discuss the protocols for the reopening guidance that will be as of June 1st, hopefully, and discuss and describe health and safety measures that should be considered for employees and customers. And so, as you know, the reopening guidance that was issued by the governor related to how customers should interact in your establishment. And this is an illustration of really making sure that at the entry point, there is sanitizer readily available at the entrance. Customers must wear a face mask or other cloth facing covering. And also the arrangement of furniture and chairs, making sure that they're 6 feet apart, as well as making sure that both the employees are also wearing face shields as well as a face covering or face mask underneath the shields, and that there's no one in the waiting areas, and that everything should be done by appointment. There's also recommendations about contactless payment is encouraged and disinfecting protocols to be utilized. So this is an example of the inspection form of what to inspect. The inspection is broken into these different categories. It is going to be this form can also be found on ct.gov. And so anything that's highlighted in red requires immediate attention to avoid any potential closure. And so we ask that there are proper sanitary conditions in place. There's customer protection, licensors, as well as facility of the hand washing stations and approved waste of water sewage disposal. And I'll walk us through a little bit about that process momentarily. Before the beginning of the inspection process, we want to make sure that we talk about the operations of the status of the establishment with the owner or the management. So it's important that the owner or manager of the facility is present to talk about day-to-day operations. We want to make sure that as you prepare to reopen, weeks beforehand that there's proper training of your employees regarding the new reopening guidelines, and that the protocol for reinspection the inspection process is outlined and clear to each of the employees, so that there's also training around the sanitation and the cleaning, and that there is a plan in place for utilizing things that will not be shared with each other. Determining a written cleaning plan that needs to be essential. We will be looking for a protocol and a written cleaning plan of what that looks like, and making sure that there are approved EPA products being used. We want to ensure that the entire facility, including equipment, has been cleaned before reopening. Copies of all necessary cosmetology, health, and barber licenses are all displayed for the employees and posted accordingly. The employee health and safety measures are in place. We want to make sure that you establish a schedule for employees, and that there's staggered shift, so that you can have a start and stop time and break times to minimize any contact with each other. We ask that you limit verbal communication between employees and clients when there is less than 6 feet distance between them. All employees must wear the mask and coverings at all times. Gloves, if used, should be removed and discarded accordingly. We are asking that you have touchless waste baskets if possible. Ensure that staff are familiar with the signs and symptoms of COVID-19, and that they should be displayed and know how they can report that to the employer. Staff must go and undergo a daily checkup among arrivals. So pre-screening employees upon arrival should be monitored, and a daily log should be maintained. So employees should be should be trained in effective and proper hand washing as well. So as part of the training protocols, you want to make sure that hand washing stations must be present in all workstations and must be functional. They must reach the minimum temperatures, be fully equipped and stocked with the proper paper towels, soap, trash cans, and hand washing signs, and have it easily accessible. We ask that customers wait in their cars until their appropriate appointment times. All non-essential items should be removed from the establishment. This includes any pamphlets, magazines, self-service coffee, water stations, touchless appliances, as well as process of payment. We are encouraging contactless process of payment. You should have a credit card machine or another method of payment to avoid touching cash. We ask that hand sanitizer be placed at the entrances and exits of common areas of the establishment, and that proper signage be posted throughout to report any of the violations. If they should be any, customers should know how to report violations. Customers are again required to wear a mask and have a mask covering at all times. Main salon and the signage area again should be by appointment only. So you should have the new rules of your facility that have the following. Visits are by appointment only, social distancing and cleaning disinfected protocols, that you have personal protection protocols, and signage of employees should stay home if they should become sick or experiencing symptoms of COVID-19. Customers should not enter if they are experiencing any symptoms. Those signage should be displayed in prominent area. Social distancing, again, should be marked accordingly. So you should have floor markers of 6 feet apart between staff and customers should be placed on the floor. Barriers should be installed in work areas and provided for maximum social distancing among staff. Establish discrete work zones for staff members in their preferred area. Establish clear pathways and social distancing marking on the floors that distinguish between customers and staff. It's also critical as you're doing cleaning and sanitizing of equipment that there's proper ventilation increased throughout the establishment. Try to maintain doors and windows be kept open in the air if air conditioning is not an option. Clean and disinfect workstation. using approved cleaners and disinfectant in between customers. Allow 10 minutes at least between that, so you can, between your appointments, so that you can make sure you have proper cleaning time. Tools must be cleaned and properly disinfected in between clients. Is very critical, that in order to have these things in place, you have enough ample time between customers. Also, disinfectant solution must be legibly labeled with the disinfectant name and the dilution requirements. Disinfectant solution must be made daily and disposed of at the end of the day or immediately if visible debris is present. As per the Connecticut Department of Public Health, laundry of your establishment should be cleaned properly and laundered properly with hot water, and should be maintained in a permissible clean linen area. We ask that you not reuse any single service items and that they should be discarded appropriately. We ask that linen and capes be stored in a closet cabinet. We ask that shampoo bowls be disinfected in between customers. And we ask that utensils be washed in utility sink, not the hand sink. A sanitary paper strip or clean towel must be placed around the customer's neck before applying a reusable cape. A covered receptacle must be available for hair, skin, and nail debris. And blow dryers are allowed to be used despite an earlier ban on them. When we talking about maintaining your establishment, restrooms are very critical to maintain a log of when you're cleaning them and making sure that they're cleaned frequently in between customers and employees. They should be properly stocked and have clear pathways so that there's proper social distancing markers available. We ask that you have touchless items and appliances as much as possible. So in summary, we will be conducting inspection during the reopening period of 6/1. An online inspection form will be made available. We will be putting this form live on our New Haven Health Department website in the very near future, and a press release announcement will come out so that you know that that online inspection form calendar to sign up for an inspection will be available to you. We ask that employers must provide workstation training before the reopening requirement. And we ask that you must display the proper signs and licenses in all visual areas so that we can make sure that they are adhered to. Thank you for the time. I will turn it over back to Kathy Graves.
Thank you so much, Maritza. Now we have Doctors Carrie Redlick and Dr. Queenie Abad from Yale Occupational and Environmental Medicine to talk more about the virus itself, how it's communicated, how you protect yourself, the masks, the different types of masks, the pros and cons. So doctors, thank you so much for joining us this afternoon. Take it away. You have to unmute. You're on mute. You're on mute.
Sorry, I thought there it is. Okay. I'm Dr. Carrie Redlick. I'm director of the Yale Occupational Environmental Medicine Program. And our other doctors, Dr. Queenie Abad, who's one of our occupational health physicians. So, and hopefully we'll have time for questions at the end. So Queenie, I'll let you start.
Okay, thank you, Dr. Redlick. And so this portion of the presentation will, like Kathy said, focus on how the virus is transmitted, and really will focus on what employees and everybody can do that's in their scope of influence to protect themselves when they are going to work and also when they're going out in public. We did a similar talk with cafeteria workers a few days ago that was well received. I'm going to go to the next slide, but thank you for inviting us. So we'll just go over a very brief COVID-19 overview. As you know, the SARS-CoV-2 virus is the virus that causes the COVID-19 disease. It is a coronavirus, and there have been other outbreaks of coronavirus, SARS and MERS in the past. That was in 2002 and 2012. And so one of the main ideas to take away from this talk is how SARS-CoV-2 can spread. So as Connecticut is reopening, the virus has not gone away, but by knowing how the virus is transmitted, we can then identify areas of risk, and then really how to mitigate those risks and to protect ourselves. And one way to do that is know how SARS-CoV-2 can spread. So the main way that the virus spreads is via respiratory droplets. And so what does this mean? If you look at this visual here, when somebody who's infected coughs, there are droplets in various sizes. There's large ones that drop to the ground. There's medium-sized ones that can go a few feet. But then when someone sneezes or sings, there are smaller droplets called droplet nuclei that can travel further. And so those are the ones that we can't see. And so they can happen when we're sneezing, when we're coughing, talking. We're producing respiratory droplets, which can then land in the mouth of somebody else on a surface that then gets contaminated, etc. And so that's the main way it's spread, via respiratory droplets. The other way, secondary way that it can spread, I mentioned already, is through these contaminated surfaces. Let me see here. Oh, I think I went. Okay, here you go. So I was gonna play this sneeze cloud, but since we're got started a little bit later than planned, I'll just talk more about when somebody coughs. I already mentioned big droplets fall to the ground. Medium-sized ones travel a little bit, a few feet, then the really tiny ones can travel further. And so the sneeze cloud just shows these droplets as they're going through the air. So symptoms I won't talk about in extents, but when somebody is infected with the virus, they can go 2 to 14 days after they're exposed and not have any symptoms. But within these days and after, the person who's infected can exhibit signs of the virus, like coughing, one of the main ones, fever, chills. One of the other ones that have been coming out about the virus is loss of sense of smell and loss of sense of taste. And that's something that's been really specific to SARS-CoV-2. And other individuals can go on to get shortness of breath and some with pneumonia. There have been some GI disturbances, but those symptoms have been less common. So these are the few ways that someone who's infected can exhibit symptoms. There are 2 main ways that we can test for exposure to the virus. The main one that has been given out to people when there's a suspicion that they have a current infection is the viral test, the nasopharyngeal swab. So that's the graphic up here. There's a swab, and somebody puts it into your nasopharynx, inside your nose, and puts it deep enough so that it can get a sample in your upper respiratory tract. Okay, so this nasopharyngeal swab shows if you have current infection. You're currently infected now. So it can provide fast results, but the main thing is you need a good quality swab for it to be accurate. And because of the test characteristics and the quality of the swab that you need, it can have some false negatives. The second main testing modality is via an antibody test. And this has been talked about in the news more recently. This is a blood test. Compare it to the nasopharyngeal swab for the viral test that I just talked about. So this antibody test, blood test, shows if you have been exposed to the virus in the past. And studies have shown it takes about at least 10 days after exposure and infection for the body to produce antibodies. So because of this, it may not show current infection. And like I said, it takes several days, a couple weeks, for the body to make these antibodies. I've got the window open, so that's what the noise is. So there needs to be ongoing studies on how we're going to use these antibody testing. There's been a lot of talk about using it for deciding whether someone can return to work, but that's not something that we're doing right now. And the fact of the matter is the antibody test and what it needs more studies. And we've got a study going on at our department now to learn more about the antibody protection and how long someone can remain immune, if they can become immune, if they develop antibodies. So those are just the two main types of testing for coronavirus. A lot of the questions that we get are individuals asking us what their chances are for getting COVID-19. And the answer to that is it varies. We can think about it in kind of three main risk categories. This is a graphic from the CDC. And so, over here on the left side, we consider someone low risk if the individual is just in the same room for a short amount of time with another individual who is confirmed to have COVID-19, but they're more than 6 feet away. So just being in the same room for a few seconds, couple minutes, you're low risk as long as you're more than 6 feet away from that person. In the medium risk category, this really means you're in the same room as the symptomatic individual, and you're within 6 feet of them for a prolonged amount of time. Now, what's prolonged amount of time? We consider prolonged amount of time as being 10 minutes or more and being in close contact with the individual who is exhibiting symptoms. So people who are in this medium risk category may be individuals who are caring for someone who has COVID-19, and they're having to spend a longer duration of time with them in the same room, okay? In the high risk category, that's basically what I just talked about, someone who shares the same living quarters. So you're in the community, you live with somebody, a partner, kids, or whoever else, and you're living in the same space, you're breathing the same air for longer than 10 minutes, hours, the whole day. Okay, so this is someone who's caring for someone who's actively sick. And these are really how we should think about categorizing our risk of getting COVID-19, okay? So what we do in occupational environmental medicine is, pre-COVID, what we were doing was assessing workplaces for exposures, okay, assessing hazards. And so whether it's a chemical hazard or a physical hazard, or in this case of COVID-19, whether it's an infectious hazard, we think about identifying and correcting the hazard in the same way. And we do this by using something called the hierarchy of controls. And so if you look at this graphic, it's an inverted triangle, and we go from least effective measures to the most effective measures. And as you can see here on the bottom, PPE, aka personal protective equipment like masks and gloves and gowns, are ways to protect oneself. from exposure to the virus. But as you can see, it's down here on the kind of the, quote unquote, least effective end. And so what we like to do is all of these are important together. So when you're in a workplace, the workplace should be doing PPE, administrative controls, and engineering controls. Administrative controls change the way people work. So you've probably heard about people changing shifts or clustering how many people are in a shift, okay? These other examples are increased training for employees, increasing signage, staggering shifts, like I mentioned. We go up to the yellow here, which are the engineering controls. And so when we're thinking about an engineering control, these are really ways to separate the person from the hazard physically. So these, you've probably seen in the grocery store, plexiglass barriers, moving things outdoors, improving ventilation and air circulation inside the facility. The most effective controls are up here, elimination and substitution, but unfortunately, we do not have the capability to eliminate the virus from the world yet. And, substitution's not gonna do much. So when we're gonna go forward and talk about specific examples of changes in the workplace, we're thinking about this hierarchy of controls pyramid, okay? So down here in PPE, when we're talking about the general population, why are we wearing masks and why are other people wearing masks? Well, if you remember from several slides ago on what is the main way COVID-19 spread, it's via respiratory droplets. And so wearing a mask, like these individuals here, prevents this person who, maybe they have a cough or runny nose or sneezing, it prevents them from spreading their droplets to the other person. And the person wearing it, they can be protected from this person's physical droplets from going onto their noses or their mouths, okay? And so as far as CDC recommendations, right now, individuals should be wearing masks, cloth masks in public at all times. And especially in scenarios where it's impossible to maintain a distance of more than 6 feet, okay? And so something that, you've probably seen when you're walking around is, people are wearing masks, but because they're wearing masks, there's this idea that, oh, I must be protected. And, they're standing within 6 feet of each other. The important thing to know is masks are not a substitute for social distancing of greater than 6 feet. Okay, we need both. So what does this look like in the workplace? And so there's the document here, the Hair Salons and Barbershops document from the Reopen Connecticut guidelines. And so that will talk about specific barbershop and hair salon recommendations. We're going to be talking about general ideas here, okay? So when you're wearing your mask in the workplace, you need to wear it throughout the day. And the most important thing is that it's worn the correct way. And, sometimes you see people with their masks on their chin or their mask is only covering their mouth. Remember, for the mask to be most effective, it should cover both your nose and your mouth, and it should be secure and close to your face, okay? It's also important that you clean your mask regularly, especially if it's a cloth mask, and to not share it with other people. Okay, another PPE that has been worn a lot are gloves. And so I forgot to edit this last side, but you'll wear your gloves using the regular procedures when you're doing the work in the salons and in the barbershops, okay, to maintain safety. Another question that we often get are, which mask should I wear? There are, for the general public and for people like in healthcare and in manufacturing, there are three types of masks that individuals will come across. This one here, and I will call it teal color, is the N95 respirator mask. Okay, it is FDA regulated and it's called N95 because it has the ability to filter out 95% of the small airborne particles in the air. Okay, the main thing here is these are should be reserved for people in close contact with symptomatic individuals who are ill, i.e. healthcare workers. Okay, so individuals who need N95s are the healthcare workers. The next mask that people have probably come across are surgical masks. Okay, so these surgical masks are the ones that healthcare workers also wear. Okay, and their use is to protect against large droplets and splash of bodily fluids like blood or phlegm or sputum from patients. Okay, for the general public, the masks that are recommended by the CDC for the public are the cloth masks. So if you're asymptomatic and you're part of the general public, these are the masks that are recommended. Okay, so the main point on this slide is when you wear the mask, you're protecting other people from your respiratory droplets from falling on them if you're infected. And number two, the mask that's worn by other people around you are there to protect you from their respiratory droplets. Okay, and like I said, the recommendation from the CDC is that people in the general public wear the cloth type face masks. I already mentioned a little bit about, if you're gonna wear the cloth face mask to be effective, please wear it the correct way. Okay, so when you leave the house and you're in an area where you cannot social distance more than the 6 feet, you need to be wearing the masks. Make sure, like over here in the picture, that it's fitting closely to your face. You can probably you probably have seen when you wear your own mask that sometimes you can see gaping holes. So make sure that when you are wearing a mask or you're getting it made, that it's fitting snugly over your face, so that you don't want to impair or decrease the way you're breathing, but make sure it's not wide and gaping open. All right, the most important thing is that it fully covers your nose and your mouth. And so there's been studies on how effective are cloth masks. The general principle here that I want to communicate is the more layers that the cloth masks have, the better it is as far as protection. You don't want to wear too many layers to the point where you're having trouble breathing, but having 2 or 3 layers is probably better than having, one thin, flimsy layer. All right. And, you have the secured ear loop ties so that it doesn't move. Okay. So next slide here is just talking about how to properly clean and remove the mask. So the main thing here is before you touch the mask is you wash your hands when you touch it or adjust the mask. Okay. And so after you use the mask, try to grab it by the ear loops, not by the cloth side. And do not touch your eyes, nose, or mouth. Okay. After you handle the cloth mask, it's important that you then go and wash your hands. This one here, not sharing masks, is, doesn't need to be said. And as far as cleaning, laundering it with your regular detergent and water is going to do a good job of cleaning the mask. Okay, you can do it on machine dry hot. And make sure also to store it in a clean container. So, you know, you want to put it in somewhere where the mask can breathe. So you can use a brown paper bag, which is what we use here in the clinic when we're using our masks here. So this is something, so an administrative control is changing the way we work, meaning washing your hands more often, okay? And so the most important part about this slide is that, yes, you should use soap and water to wash your hands, all your fingers in between the crevices, the nails, and you wanna do it for at least 20 seconds. Soap and water is the preferred option, and you should do it frequently throughout the day, but especially before you're eating and after you're eating, just because you're handling, you know, you're touching your mouth and your nose when you're eating your meals. Everybody knows after using the restroom, when your hands are visibly soiled, and then after you're going into your, so after a day's work, you know, you're going home, you closed up the shop, you're going into your car, driving or walking or riding the transportation back home. When you enter your house, the first thing that is recommended is that you go and wash your hands afterwards, so that you can come in and have clean hands. Okay, so the other question we get is our questions about hand sanitizer. And so the preferred option, like I said, is soap and water, and especially if you see dirt or any fluids on your hands. But, you know, we use sanitizer in situations when there is not soap and water, okay? So if soap and water is not available, you can use hand sanitizer, but make sure on the bottle that it's the type of hand sanitizer that will work. And so you want alcohol that's 60 to 70%, and that's best to make sure it's effective. All right. And so when you're using hand sanitizer, it's important to also use it the correct way. So, you know, cover the surface of your hands, rub your hands together until they're dry. And the other main point here is, you know, we hear a lot about homemade hand sanitizers or essential oils. Our recommendation is that, you know, we stay away from homemade products because we don't know what the quality control is or their efficacy. So if you're going to use hand sanitizer, you want to make sure that it's something, you know, that is going to work. So at least 60 to 70% alcohol. So the next section here is environmental cleaning. Okay, as you recall, this second way that the SARS-CoV-2 virus can spread is via a contaminated surface from somebody's droplets. Okay, so the main thing is if we have the right disinfection products, these products can effectively kill the virus, specifically SARS-CoV-2. Okay, and the main thing here is that we need to be using the right products. So there are pretty much two steps when you're cleaning and disinfection or cleaning and disinfecting. Okay, and they're different. So cleaning is using soap and water to physically remove any visible dirt or debris. Okay, you're not killing anything when you're doing that. The other word you're going to hear is disinfection. Okay, disinfection is the specific term to use when we're talking about killing germs on surfaces. And we want to pay attention to high touch surfaces. And what high touch surfaces means is basically think about all the things that we're touching a lot throughout the day. Doorknobs, your keys, if you have a badge, cash register, steering wheel. I'll have a few other examples later in the slides. The main point here is that we need to use the right stuff And so if you go onto the CDC EPA website, there is a list of EPA approved disinfectants. They're all different. And so it's really important to follow what it says on the label. All right. The next one is bleach. Bleach works really well with killing the SARS-CoV-2 virus. Be very careful with bleach because the solutions that you can find in the stores are often 100% bleach. They are not diluted. And bleach can be very dangerous if you're using it undiluted. So make sure you look on the bottle and see if it's already been diluted and ready to use, or if you need to go through diluting it with water, adding water. I actually had a bleach burn at the clinic several weeks ago, so I know how powerful bleach is, which is good, but it can be bad if someone does not know what type of bleach they're working with. And third, alcohol solutions that are at least 70% and hydrogen peroxide. We're actually using both of these in the clinic. Alcohol solution in a bottle that's 70%. And then we also have hydrogen peroxide that we use to spritz our check-in area at our clinic. Okay, and so we hear a lot. The other thing about disinfection is we hear a lot about contact time. How long does the surface need to be wet with the solution, whether it's alcohol or hydrogen peroxide or bleach, in order to work? It depends on what you're working with, but probably with things like bleach, 5 minutes is probably enough time, or even I've heard 3 minutes is probably enough time. In this document, I did notice that it said 10 minutes. And so, you know, if the document says 10 minutes, it's probably the best idea. You know, it's not going to hurt adding 5 more minutes of waiting and allowing the disinfectant to kill the germs on the surfaces. Okay, so 10 minutes is going to be plenty of time to be able to kill the virus if it is present on a surface. So let's see here. The most important thing on this slide about environmental disinfection in the workplace is really disinfecting those high-touch surfaces, and especially if you are sharing surfaces or tools. So think about, you know, here at the clinic, we've got one computer at the desk, okay? And 2 or 3 people can be typing on that computer. And so if it's a shared surface like that, after every use, it should be disinfected. Okay, so cash registers, computers, if you don't have things like contactless payment, the reception desk, the light switches, the door handles, and especially working in barbershops or hair salons, I know that a lot of people have their own workspaces and probably have their own tools that they use. But if you know you're swapping tools or if you're sharing workspaces, make sure that before you transfer it to somebody else that you are disinfecting it. Okay. Let's see here. Personal items are sometimes are things that sometimes we can forget about, including me. So you know, think about cell phones. How many times a day are we touching our cell phones and texting and calling people? And the case, you know, your eyeglasses, your keys. And so these are all the things that have are high touch surfaces, which should be disinfected. Okay, so this is just a picture of a couple workplaces that are doing engineering protocols. And so these protocols physically isolate the worker from the hazard. So, you know, think about when you're going to the grocery store and there's the plexiglass, the drive-through windows. And then here, you see here at this nail salon, there's they are both wearing masks. They are, and there's this plastic plexiglass barrier, AKA a sneeze guard that's up, that is physically isolating the worker from the customer. Okay. So this visual is something you guys have probably all seen if you reviewed that reopening Connecticut processes for the hair salons and barbershops. And so I just took this image that I found in there and blew it up. So this is what the hierarchy of controls is going to look like in a barbershop or hair salon. All right, so let's start here at the entrance. This person has access to this hand sanitizer before they enter the building. Okay, when you go into the building, you see that there is not other people waiting. So that's part of socially distancing individuals, and also I would say part of an engineering control. Okay, because you're having people wait outside instead of waiting inside, where you can potentially be breathing the air that another person is breathing. Or okay, so like here, no waiting areas, so appointments only. Okay, and when you go into the facility, you can see that both the customer and the worker are wearing masks. The workspaces are 6 feet apart. There's disinfectant wipes here at the table. And here they have implemented contactless payment. Okay. All right. So this is the last slide that we have. There is a hotline if a worker or customers also feel like the workplace is not safe. Okay, so if someone would like to report a violation of a work area, there is the state hotline. It's 211. And just remember that you're protected for voicing your concerns. Okay, employers may not retaliate against workers for raising their concerns about COVID-related safety and health conditions. So remember, if you have concerns, it's always safe to call this 211 number. Okay, so as far as the summary goes, remember that the primary spread of SARS-CoV-2 is from droplets. If you know about the hierarchy of controls, you can identify where the risks are and you can engineer them away. And you can, and this is really the basis of many of the work policies. Okay, so the things that we talked about here are allowing you to decrease your risks of SARS-CoV-2, okay? And you do have a right to workplace free of known hazards. So here, I'm gonna turn it back over to Dr. Redlick or Kathy, so that we can get some of your questions answered. And we do thank you for your time.
Thank you so much. We do have a couple of questions, and anyone that has more questions, please feel free to ask them in the chat. We do have one question, but I think we do know the answer to it. Do you think you can contact COVID if your customer doesn't talk or breathe heavily without a mask on?
Yeah, I would say that you want your customers to wear a mask. Okay, I realize that maybe for doing a beard or, someone might have to take it off briefly, but you still would encourage all of your customers to wear masks for as long a period of time as they can.
Okay.
There's another one, Kathy. Do you want me to do the questions or do you want to just do
Yes,
them?
go ahead.
Okay. Anonymous attendee is wondering something about surgical masks. The colored side, is that face in or face out?
Let's see, I have one here. I think, let's see if I put my.
We got a live demonstration for you.
I can't see if I understand myself, but so you want the colored side out. This case, this one's a blue one, the white side goes in. And as discussed, you just want a tight seal around your nose and around face.
Looks great. I know there's a lot that have the pinching thing here to kind of pinch it on your nose. I don't know if that one does. Another question from Corinne. What if you only have a bathroom sink and not a hand washing sink? Oh, looks like, okay.
You have to have a bathroom sink and a service area sink separately.
So they just need a designation.
Correct.
Gage, do you see the one about blow drying?
I got a couple coming in, but we could, why don't you read the blow drying question and I'll take these other two.
Is it safe for blow drying in a closed environment?
So I know there's been a lot of discussion about blow drying hair. There really is not much data. I mean, it's a theoretical concern that maybe you would make the virus more airborne. I think that generally you want to minimize blow drying, but I think it's okay to do that. You know, hopefully, number one, their customers aren't going to have COVID because they've been screened out. And number two, they're going to be wearing a mask so that even if they didn't know they had it, the virus would not be getting into the air. So I think the strategy would be to, you know, do what you need to do, but to minimize the time.
Thank you. I heard you were to say that hand sanitizers are to be outside. So in the hot sun on days like this, what happens to this product?
So I had said the entryway. So when you enter or exit, not outside.
Does anything happen to hand sanitizer when it's in the hot sun? I guess that would be a follow-up question for this.
Let's see. I guess the alcohol could evaporate and you could have less hand sanitizer present, but I would think as long as you have liquid there, it is probably effective. It should be effective.
All right, thank you. Any tips?
If you can keep anything out of the sun, it's probably a good idea to do that.
Mm-hmm.
Awesome. Are there any tips for wearing masks and glasses? I know there's some fog issues. I've experienced them when I have my sunglasses on.
Yeah, so I have been reading up on this extensively because I have this problem. And you know, people have suggested making sure it's very tight over your nose so that you're not getting air up. I have found, and some people have suggested the type, some defogging, like what people sometimes put on ski goggles. I haven't found that to be particularly helpful. I think if the general temperature of the room is cooler and less humid, that will help. But not over, when you exert yourself more, like running up and down stairs or the like, you are gonna then have more likelihood to have fog. And obviously if someone does wear, you know, not glasses, but contact lenses, that would solve the problem. But I think there are many people like myself who have trouble with contact lenses.
I have one here. How many clients can you have in a salon at a time? Does it depend on the salon size?
One client at a time, and then other clients should be waiting in their vehicles.
Do we have to be inspected prior to opening?
No, you can open once the governor declares an opening date. And so tentatively right now it's June 1st, but we want to make sure that we get a full update from the governor's office. You will be allowed to open. You should have a scheduled inspection date, however, already in mind. So we ask that people log on and visit our website at the New Haven Health Department within the next couple of days to set a scheduled inspection.
You know, I think one also general principle as far as risk, just to mention this so I don't forget, is it's really the amount of virus, like the concentration that might be there over time. So brief encounter, the briefer an encounter is, I know people get scared, but walking past someone, that, you know, in brief encounters, so that some of the horror stories people have heard about the dinner party and the like, those were hours events that lasted hours in enclosed, crowded conditions. So I think, having one person and getting them out and having people wait outside is very effective, along with ventilation.
There's another question here. When you wash your hands, does the soap have to be antibacterial?
So ordinary soap is effective with washing your hands. As said, if you don't have soap and water, then that's when you want to use Purell or one of the hand sanitizers.
If a salon is 1,900 square feet, is it still one client?
So it's one client per salon, and you have to maintain the 6 feet rules that we indicated earlier.
How will barbershops handle facial hair?
You have to work around not removing your mask. So it's recommended that masks be used at all times. And so you may have to modify your services.
One suggestion I've heard is to just say, look, we're doing these services right now, and we're not doing, others that would involve taking the mask off and providing those services at a later time.
I know there've been questions around wearing a face shield. Is that required?
It is required.
So I guess some clarification for Jenna here. Is it one client per stylist or per salon at a time?
It should be per stylist, and it should if they have to maintain the recommendations outlined earlier, and the reopening guide is also published on ct.gov. You have to maintain it and have the proper markers of 6 feet apart between each stylist.
Is there a limit to scheduled clients per day? If so, how many?
You will have to modify your schedule based on the clients you can see, maintaining the infrastructure that was outlined. So you would have to really look at the space. You will have to look at how you're maintaining 6 feet apart between each stylist and making sure that there's one per stylist at a time. So you would have to do a sort of like a mock-up before you open up.
What is the link to schedule a salon inspection?
It will be on the New Haven Health Department website. In about 48 hours, it will go live.
Kathy, I think it makes sense for us to share that link with you so you can get it to the folks that are participating here. So we'll let you know when that's live.
Okay.
I have a collection of face shields, about 40 of them that have been made, some of them by my son. If I can, if there's someone is in need of them, if there's a way to distribute them, I'm happy to donate them.
Thank you.
Great.
So,
Okay, we've got a couple more. Is it possible to schedule 3 to 4 clients 2 hours apart to have time for disinfecting?
It will depend on what you're servicing.
So a mask may help. What do I do about the clothes, specifically a shirt that may have been sneezed or coughed on prior to their visit? How do I know?
that's a good question. You don't know for sure. I think what you want to do is, when scheduling an appointment, this was probably mentioned, anyone who has been possibly, feeling not themselves, you don't want them to come in. And I think that should just be really strongly, reiterated. And even though you may have asked that question when the appointment was scheduled, at the time they arrive, I would just confirm that they have not been, feeling ill in between the time of scheduling the appointment and coming.
Anonymous has got a lot of questions today, and there's another one. Who will be inspecting barbershops and salons, the city or the state? Are there enough bodies to do all these inspections?
So there are enough sanitarians that will be conducting the inspections citywide, and they will be scheduled throughout the week after the week of June 1st.
To answer the question, the city is doing these inspections, right?
Correct. Local cities,
Got it.
sanitarians.
I would strongly also encourage if employees have concerns, about their salons to, to call that number. And
Correct.
I was on the governor's task force and if I think people want to know if you're calling the number and you're not getting a adequate response, but please have a low threshold to call, because otherwise there are lots of establishments and it's the only way we'll know if things are not happening the way they should be is if people call. So I would pass that on to everybody.
And there's also an online through the Department of Economic and Community Development online at the state, ct.gov. There's also a link that you can file a complaint as well. So you can do it 2 ways. And you can call your local health department at 203-946-4949 and file a complaint.
They're saying the t-shirt question was not properly answered, and I believe that question was more about if someone sneezes or coughs and they come into your establishment. I think we can just maybe add a little more detail to how to get around those things, and I think encouraging people to get tested is one of those things that you can do.
And I also if one has if people getting their color the like done or given a gown or anything to wear that covers up their clothing, that will not then be able to touch the shirt. I would also just remind people that I know that it's important to clean surfaces and not minimizing that, but really respiratory transmission is the greatest concern. And one of the other real advantages of you wearing a mask is that touching a surface is not going to give you COVID unless your hand then goes near your mouth or your face. So when you wear a mask, you're just protecting yourself. And I know people don't think they do it, but just about everyone puts their hands on their face, even when they don't realize they're doing it. And so that also protects you, so that it's not touching a surface that might be contaminated that is the problem. It's what you do with your hand afterwards. And that's a real advantage of you wearing a mask along with your client.
Do you recommend the disposable drapes that can be used for hairdressers or barbershops?
I mean, if people have them, those are great to be able to drape a customer and then get rid of it and not have to then deal with, laundry. The main thing is taking those off of people in a proper way, where you sort of fold it inward so that the surface that's on the outside is then on the inside.
So they shouldn't be reused before cleaning.
Oh, saying the disposable ones, you just want to, if they're disposable and you can use one each time, if you have those, that's great. You just want to take those off so that you're not, touching the outside of it as that's coming off. Or the cut, you can take it off and roll it up.
However, the cloth ones have to be washed before they're reused.
Yes, exactly. Sorry about that.
Are there any more questions?
I don't see anything. Oh, for Queenie, wearing mask and gloves while driving alone, is that needed?
No. So the route of transmission with the respiratory droplets, when you're wearing a mask, you're really protecting from other people's respiratory droplets. When it's just you in the car, feel free to take your mask out and roll the windows down and breathe the nice air, because it's just you in there. So there's really no need to be wearing the mask when you're inside the car alone.
What about wearing gloves?
There's been a lot of confusion about gloves. So the thing is, I know people feel better when they see someone has gloves on, but gloves don't stay clean. They need to be washed. You're better off washing hands rather than gloves. So if the gloves are needed for a particular task, such as putting color on, then you want to wear gloves. But in terms of someone paying or various, you want to wash your hands, because gloves, you have no idea when the last time someone washed those gloves. So that's also more, that's sort of more of a false reassurance in terms of gloves.
And I will echo what Dr. Redlick said a few minutes ago about it's really what you do with your hands after you touch the surface, because you could be wearing gloves, but I've seen a lot of people wearing gloves and then they go on their phone and then they touch your face and then they touch their eyes, and so now what was on the outside now is close to your respiratory, your nose and your mouth. So the gloves you can do for food handling and, like Dr. Redlick said, doing the coloring, but it's really what you do afterwards.
And actually, just in terms of driving around in your car, if you do have a little hand sanitizer or the like, I actually keep some in my car. So if I am going to a store and they don't have something, if I get in my car, I'll use the hand sanitizer. So if you have any, you don't really need hand sanitizer at home, because then you can just wash your hands in the sink and save your hand sanitizer. But if you do have a little bottle, then keep it with you.
I don't see any more questions.
If there are no more questions, I just want to say thank you once again to our panelists. Hopefully this has been informative and you better understand COVID and you better understand the rules on how to apply them and how to apply them when you open on June 1st. If you have any questions, you can reach out to any of us. We will share the link that will be going up in the next 48 hours, Maritza. In the next 48 hours, we'll share that link with everyone. And once again, feel free to contact us with any questions.
We got one more question. I want to get it in before we sign off here.
Okay.
This question's about customers. What do I tell the parent or mother of 3 to 4 children? Have them wait in the cars and wait on their haircut? I think is the question. I think the question is if people have other people with them, what do they do? It's not very clear.
Well, I think
I have a response to that. Oh,
yeah, sure.
So we did respond to this the last time when we conducted the webinar. If it's a minor and it's it's a toddler, of course the parent can accompany their child. They're a family household, so they're already together. If it's an adolescent or a teenager, obviously they can accompany themselves. So it's really about the age of the minor.
All right, one more, and then we'll sign off. There are some salon owners that aren't financially able to purchase disposable capes or dividers. What can be used as a substitute?
We are recommending, if people are not able to provide the necessary PPE, that they should not open at this time.
Alrighty, that's all I am seeing for now. I think everyone's got Kathy's number. They can call or email with any questions and we'll be able to.
Thank you, everyone.
And we're happy to take, if there are any work-related health questions related to any of this, you can get in touch with us.
Thanks, everybody.
Thank you so much. And thanks again, Gage.
My pleasure. Take care.